Dr. Chase Van Mall, thank you for being here today.
Thank you, Blake.
So today we're going to talk about what does it take for a concierge physician to stand behind advanced diagnostics and decision making. But before we dive into that, I'd love you to give us a little background on who you are, what you do.
Well, I am Chase Van Mall. I'm an internal medicine physician. I am the medical director and only physician of Chase Wellness. So that's my concierge internal medicine practice. I'm doing traditional internal medicine, but also a lot of longevity and newer stuff. It's been a joy to have it grow, establish it, make it exactly what I want it to be. Prior to this, I was a hospitalist. So I was doing internal medicine in the hospital only for about 10 years and went through 3 pregnancies and
Wow.
the pandemic, working, all through, full time the whole time. So
Safe to say you're enjoying concierge life a little
yeah,
better.
absolutely. I mean, it gave me incredible experience and
Sure.
so much exposure to chronic disease, acute disease. So I wouldn't take it back at all, but it is definitely a change in lifestyle that
That's
I am
awesome.
embracing.
Yeah. Well, thank you for being here. I'm super honored to have you on. Your patients, everybody I speak to absolutely loves you, loves the work that you're doing. So
Thank
congratulations
you.
on having a successful and thriving practice. So
Thank you.
you work with a lot of patients trying to be proactive about their health, right? Where does it get complicated?
Well, so I mean, part of being proactive, that's really my stance on everything. Since I have gone into the primary care world and having been in the hospital world for so long, I realized that proactivity and trying to find disease, before it actually occurs is, obviously much better medicine. It's complicated in the data. There's a lot of stuff out there.
Mhm.
It's hard to keep track of everything for every patient because there's so many data points, so much input, so many possibilities of what you can do. And honestly, there's new things every single day. And a lot of times patients are bringing stuff up to me. Oh, have you heard this? No, I haven't heard about it. Let me do some research and I'll get back to you. So
And I'm sure you guys get the reps coming in every day like we do, where it's just like, hey, here's the best new peptide, the best new lab, the best new device, the best new, it seems like it's never ending.
yeah, it's never ending and it's hard to know what's real and what's not. So a lot of it is personal experience, patient experience, doing my own research, going back to the literature because that's really, the basis of medicine is, what clinical trials have been done on this,
Mm.
what is actually proven and what is, hogwash.
That's great. So talking about too much data, right? How does that show up as a challenge for you as a physician and for your patients?
I mean, really just trying to keep track of everything. Even with using AI, which has been integrated into my EMR, there's so much input coming from every direction. Trying to keep track of everything, both from the result standpoint, the timing, um, my brain power. It gets overwhelming. Just the sheer amount of data that you can go out and get. I mean, I have people who get their labs from Function Health, and then I have to input those,
Mm.
or they're going here for a scan, or they go to this other doctor, and I have to take that person's opinion into account and speak to that doctor and get everything okayed when so that we're all on the same page, to practice better medicine, but also to make the patients happy.
Yeah. So you ever find data that's noise that's not useful?
A lot.
A lot of it.
Yes.
Yeah. How do
Yeah.
you discern between what's signal and what's noise right now?
I mean, I try to use my common sense.
Yeah.
Like I said, I'm traditionally trained, and while I have gone into this longevity space, and there's a lot of cool, new, interesting things that I do believe in, you really have to sift through it. And I tell people very honestly, like I don't think that there's any merit to this, and I'm gonna pretend that you didn't run that test without my permission.
Yeah. What kind of tests are people doing that like, because obviously, you were doing BodyView scans with us and the blood work. What other scans are people doing that you're like, hey, I didn't really approve of that.
Yeah, well, there's a lot of people out there, I won't name the field, but
Mhm.
they are introducing themselves as doctors and then
Really?
running these crazy labs. I mean, I have a patient who a family member was convinced that he has toxic mold because they drew these um, antifungal mycotoxins. So once I dove into what are these mycotoxins, it seems like even though you're drawing it from the blood, you can have these from any input. It's not necessarily that you've been exposed to mold. You could eat something that
Mm.
has some mold spores in it and then it turns positive. So it just sent them down a rabbit hole of trying to treat chronic toxic mold exposure when it was not real at all.
Jeez. So
Yeah.
how do you deal with that on the back end, right? Like what's the conversation with the patient after that?
Well, the conversation with the patient is different than the conversation with the mom. So,
Mhm.
with the patient, I'm very straightforward. Like, I don't think that there's anything here. I know what we did in the hospital. I know the patients who get, chronic aspergillosis, and that is not you. And
That
I
is very
don't think
different from
that
what you're dealing with.
exactly.
Yeah.
Yeah.
So where patients in general, getting away from that particular instance, where are patients struggling the most? Like when they're coming into your practice, whether they're new or established, what seems to be the thing they're having the hardest time with right now?
Um, I think it's trust,
Yeah.
actually. I mean, most people, by the time they come to me, have seen other providers,
Mhm.
have been, through experiences in the hospital that have created a lot of mistrust in medicine, and specifically, traditional medicine. So I think it's a matter of gaining their trust, making them realize that not all statins are bad,
Mhm.
that
Sounds very
it's,
personal.
yeah, it's like the conversation. I want to bang my head against the wall every
Yeah.
single day. And I try to explain risk benefit. Everything we do has a risk, everything we do has a benefit. And what is it, what are those and how are we going to use the results? I tell people like, I'm never going to draw a lab or do a test if I don't know what I'm going to do with the results.
Mhm.
If I don't have something actionable, even if it's to say, okay, this is reassuring, that's helpful. But if I draw, a random level and like somebody asked me for
If
a
it's off, what do
cortisol
you do?
level,
Yeah.
like, okay, we can see your cortisol. If it's normal, you're going to say you're still stressed. If it's high, then we know you're stressed. So like, what are we
What are we
going to
doing
do?
here?
We're
Yeah.
still going to tell you to
Yeah.
like decrease your stress in other ways that have nothing to do with your cortisol level. I don't think you have a pheochromocytoma. So,
That's a big word.
yeah.
So talking about the trust, right? Is it's huge, I think, I in our business, right? We experience trust maybe a little bit differently than what you're talking about, but I want to hear it from you and what you're referring to. When patients don't have trust in traditional healthcare, why is that showing up?
I think social media has a huge role in this.
Mm.
I mean, if you go to Instagram, you can see all kinds of people who are calling themselves experts,
The
spouting off,
biohackers and
yeah, saying things as if they're fact. When okay, I mean, I don't doubt that these people are knowledgeable and they have their opinions, but when that goes to a regular consumer, it's interpreted as fact. This person's
mm,
an expert. They said they were, and this must be true. So, I mean, I can't tell you how many worthless Instagram posts get sent to me by very intelligent patients
yeah.
every single day. And then the first thing I do is I go into the person's profile and look and see what their training
What's their
is.
credentials?
Yeah.
Yeah. Yeah.
And
Absolutely. Typically not many.
no, no, no.
Yeah. They're
Yeah.
good at
They
good
went
at
to a
editing
they went
content.
to a peptide course,
Yeah,
a
right.
3-day
Oh my
peptide
God.
course. So they're an expert.
They're an expert all of a sudden.
Yeah.
So that's a common problem, right? And we talked about it, even just the diagnostic data, but information overload in society in general is just any field and any human experience, you're going to have this just fire hose of information that you're trying to digest. What I'm interested in, though, specifically is patient experience, right? So when somebody comes into you and they have a lack of trust in traditional healthcare, what in their experience, maybe not something they're reading or seeing, whether it's social media or AI or online, but what in their personal experience leads them to mistrust traditional healthcare?
Um, I mean, I think being in normal healthcare settings, so I'm so fortunate to be able to be in this practice and sit down with somebody for an hour and a
Mhm.
half, and answer all their questions and get to know them and their family and what they're doing, where they're traveling, in addition to all their, healthcare questions. So I think, I mean, if you go to any traditional practice where they're taking insurance, it's about volume, and
Yeah.
it's become really sad. In order to cover your overhead, your staff, your building, your equipment, you're having to see, 20, 25 patients in one afternoon. And that allows for 10 minutes with a patient or even less.
Or sometimes not even like, I mean, I remember my most recent experience with my primary care physician, which has been years since I've been back, but I don't think I saw the physician for years before I
Hmm.
stopped going because it was just, again, 15 minutes with a nurse practitioner and
Right.
not necessarily their fault. I think everybody there is trying to do a great job and take the best care they can of the patients, but the system just kind of forced them into like, you have to be volume based or else you're not going to survive.
Yeah.
You got
Yeah.
bills to pay.
It doesn't make sense. And, for a while, especially in the hospital, there were quality measures that we were supposed to meet in order to get certain reimbursements, and those still exist. They just don't work. It all comes back to bureaucracy. And did you check this box
Mhm.
to make your quota of how many patients you have on certain medications so that you can get your bonus? So I think the system in general is broken, and um, it's a completely different experience to be able to sit down with somebody and really give them the time.
Do you think that this is the first time I've had this thought, right? Because I always looked at concierge medicine as something completely separate from traditional healthcare, which it is. But do you think that concierge primary care is kind of the future of healthcare in this country?
If AI doesn't replace all of us.
I don't think it can replace you, right? Like there's still that's funny because sorry, I'll let you finish that question.
Yeah, no, I mean, I think it's definitely much more popular than it used to be. I mean, people realize that you get what you pay for. It's the same thing with an insurance plan or with buying clothes, you get what you pay for, and if you pay more, you're going to get, in most cases, better care. And that's not knocking anybody who's doing, you know, insurance-based medicine. It's just we're all at
Yeah,
capacity.
more time. Like it's plain and simple. More time means better.
Yeah,
You're probably
more
gonna have a
time
better
means,
experience. Yeah.
yeah, better attention to detail.
Mhm.
Um, you know, double checking things, communicating more. The patients are more informed, they're more engaged, which I think is something that surprised me, that when people pay for something and when people realize that the other person is invested in it, they get really, really engaged, and the results are phenomenal.
Phenomenal. It's awesome. So let's dive into BodyView for a minute. You refer patients out for BodyView MRIs.
I
What
do.
what gave you the confidence to do that?
I think probably, I mean, started with the relationship with you, just seeing the facility, hearing about the MRI, how it compares to other MRIs, knowing the accessibility of, unfortunately, you. I can text you or call you at any point to get things done. Um, I still like the idea of a smaller place, where people can, you don't have a bunch of staff turnover. I know who to call, and I know that the results are reliable, and if I ever have any questions, then I can ask those
Yeah.
without having to go through a bunch of layers.
Speaking of, take it away from our facility specifically, looking at full body MRI. What are the benefits? Well, how do you use it in your practice?
I pretty much universally recommend this to people. If they don't want to do it, I'm certainly not forcing it on anyone. I'm in the camp of like, I would rather know than not know. I think
Are
a
you saying
lot,
that as a patient or as a physician?
both.
Both.
Yeah, both. And for me personally, again, like I've done a whole body MRI,
Yeah.
I would want to know something is there and be able to watch it than not know. I have to approach certain patients carefully. So I always tell them, like, if you don't think you can handle these results, then we're not going to do it because it's not worth it. Because you need to know that this scan can then lead to further tests. And those tests lead to anxiety. I mean, if you have something abnormal and you're sitting here waiting for your next scan and waiting for the read and what is it? And, even 6 months later, when you're doing your follow-up, you're still, it's anxiety provoking still, knowing that there's something abnormal there. And it's most patients can handle it, but I do have a select few that we don't even go there.
Just don't want to know. Yeah, it's funny.
Yeah.
I've had the conversation. This mindset is very baffling to me, but it's really how some people think. In that, I've had a person say to me, "I would rather drop dead than know that something is there." I'm like, well, if you know it's there, you can treat it. It's there whether you know about it or not, right? So why not be able to do something about it? Right?
Yeah.
What do you think?
I mean, I'm the opposite. I feel like especially if there's something that we can catch early and intervene upon before it becomes significant, then why not do that? I mean, obviously cost is an issue. And like I said, all the subsequent tests that can happen from false positives or something abnormal that ends up being insignificant. But
how do you weigh that, right? Like, how do you weigh the possible benefit of finding something early that needs treatment, right? A cancer stage, early stage cancer, versus the cost of, hey, maybe you got to do some follow-up scans and it may be nothing.
I mean, again, it's one of those risk benefit conversations where you have to weigh what the possibilities are that you may find and what you're going to do with it.
Would you say the benefit of potentially finding something early is greater than the cost of potentially having to do some follow-up scans?
Well, the American College of Radiology would say no. I say yes. I looked it up. Yeah.
I didn't know that they said no.
Yeah, they don't endorse whole body MRIs.
Interesting. Why do you think that is?
Well, number one, because they're not covered by insurance. I mean, and I don't foresee that happening anytime soon.
Yeah.
But it's again about all those incidental that we're going to find that lead to subsequent scans that are also not going to be covered by insurance. So
yeah,
it's always, years and years behind what people are doing and probably what is best practice. And
it's interesting. And I think, we'll talk more about QLP in just a minute, but what we're doing with QLP, it seems like everybody's behind it, or the industry is behind it as well. I'm interested to see how does concierge, how does AI, how do these logic systems, right, start to kind of get ahead? Who's it accessible to now? And then how down the road does it open up to everybody? So it always seems to be kind of how it starts, right? These new emerging technologies start off as kind of limited access. They're expensive. They're not super efficient in the beginning. And so, people with resources typically have first access to them. But then hopefully over time, if it's effective, if studies show that this is a useful modality, right, over time it becomes more money's put into development. And whether it's a therapy, intervention, business model, logic framework, right, over time it becomes more efficient and more accessible. Interested to see how that plays out over the next,
I mean, I think AI
decade.
is going to completely speed up this whole process of showing what the possibilities are, making everything more efficient, and then speed up the process of insurance companies actually agreeing to pay for things that we can tell are beneficial in a shorter amount of time because of, AI accessing all that technology and being able to assimilate it much quicker than we could using manpower.
Yeah. Back to BodyView, right? Let's go contrarian for a second. Full body MRI in general, what would make you hesitate to refer a patient out?
Cost is one. Again, back to the anxiety of having a result that would require their scans or, 99% of the time what we see is benign, but that 1% makes it worth doing. But there are those 99 times that I have to explain and talk people off a ledge.
This is okay.
It's time consuming.
Yeah.
It's time consuming on my
But kudos
part.
to you because we will see physicians shy away from it because they don't want to have the conversation. They don't want to talk the patient off the ledge. And what's your thoughts there, right? If a physician goes the opposite direction of where you're going, and they would prefer to hey, I just don't want to stir the hornet's nest, even though, look, they're going to find some patients that they're going to help detect something early. Not every patient, of course, but what would you say to that?
Well, I mean, if the patients want it, they're going to go get it
Mhm.
regardless. You don't at this point even need a physician's order to do it. So if it's something they want, they're going to go do it. I would rather be involved in that process than not.
Mhm.
So, well, yes, it is time consuming and anxiety provoking sometimes. It's something that I feel like is worth pursuing in majority of the patients.
So when looking at all these different diagnostics, we kind of talked about you subscribe to some of them you don't really agree with. How do you decide what you use versus what you just kind of ignore?
I mean, I'm pretty open to most things, at least to looking into if it's worth doing. If a patient really wants to do it, I'm not going to hold them back. I mean, if it's their money and that's what they want to do, it may not be something that I completely agree with.
Looking at all the different diagnostics that are available out there. I mean, under our roof, we're currently doing full body MRI, functional DNA, bioage, which also has the pace of aging, nutritional sensitivity,
Hmm.
and advanced blood work panels. We're going to add in VO2 max per your suggestion, and also CT before the end of the year. So, a lot of different things going on. We believe most of them to be useful. I'm not looking for buy-in on any of those particular modalities, but when assessing a diagnostic tool, how do you decide what's useful and what's something that's kind of just noise?
I think it depends on the patient. I
Mm.
mean, I tend to start slowly with people and with the basics. So, like, what is your nutrition status? What's your exercise? What's your sleep? What do you look like metabolically? So all these other things can give me information and give me a better picture, but I can almost assess all of those things with lab and an exam and history alone. Family history is huge. Um, so I feel like once those things are optimized, I'm definitely open or beginning to be optimized, or at least we have a plan for optimizing those things, then I'm open to all those other diagnostics within reason.
That's really
Um,
encouraging to hear. I just had Dr. Skomra in here, also concierge medicine, and you guys are talking about the same things, right? The foundation, and that's super encouraging, and it gives me a lot of faith that in concierge medicine, like you guys are doing it right. Because I feel like a lot of times those conversations are missed, at least in my experience, in a traditional primary care setting, where it's like, again, look at the labs, make adjustments. Here's this medication, and patch on the button, send you on your way. Good luck. See you again in 6 months.
yeah.
So pretty cool to hear in two separate conversations, you guys saying the exact same things are important.
Yeah. I mean, at the end of the day, your lifestyle, you can't change your genetics. And I tell people that all the time when they get frustrated about seeing certain lab abnormalities or having diagnoses that when they feel like they're doing everything right, you can't escape your genetics. But what you can change are those, foundational things. And as much as people don't want to hear me talk about working out,
It's a big
I
part of it.
embrace it. And I think that that's also important is, being an example to your patients and showing them what it looks like to, you know, try and maintain health,
Yeah, it's important.
especially a younger person.
Well, it's kind of like I mean, like, physician, personal trainer. Like you see somebody that's in one of those roles and is very visibly unhealthy. It really makes you question, like, wait a second,
Yeah.
what's
Like,
going
what
on
are we
here?
doing
Like, wait,
here?
what are we doing? Like, you're supposed to be, again, giving me this advice. You should be leading by example as well. Not
Exactly.
always the case, unfortunately.
Yeah.
So let's talk about QLP.
Okay.
First and foremost, super honored to have you involved in that whole process. I'm very excited for what it is and where it's going. But for you, it had to have been I'm very honored by you making the decision to be involved, right? And so I would love to hear what gave you the confidence or the comfort level to be involved with something like this.
Well, thank you for including me.
Yeah.
I think, especially as a physician, you can get stuck in your ways and not embrace technology the way that you should. I mean, I think the most important and most exciting part for me is using AI to not help replace me or, change my diagnostics or my skills, but to aid me in giving a better framework for patients. I mean, I'm very organized, but there's only so much I can do
Of course.
within the constraints of an EMR and, all these different inputs that I talked about that can be very overwhelming. And
And
it's
time in a
so,
day and,
yeah,
and brain power. And
yeah,
yeah, yeah.
it's hard to assimilate everything. So when I can have, a program that really lays everything out longitudinally, very organized, like this is your goal, this is the date, this is the intervention, and this should be the result. So to see that all in, lots of pages
Lots of
is
pages.
what the
Yeah.
report you gave me.
Yeah. We're working
Soon to
on,
be less
yes, we're
pages.
working on condensing it for sure.
But to be able to see that in one consolidated report is, I think, really awesome.
Thanks. Yeah, it's pretty neat. So after creating this logic system that effectively tells AI how to interpret all this data, the desired patient outcomes, we're already creating, psychological profiles on how they make decisions around their healthcare, et cetera. And then also assessing at what pace they want to attack their longevity. Something that came up for me in looking at all this is thinking about, because concierge medicine has always kind of been the objective with this program, is like ultimately we want to roll this out to concierge practices so they can utilize it. Something that came up that I thought was really interesting was in concierge medicine, the best patient is a young, healthy patient, right? That comes in, pays their membership, and you see them twice a year, right?
Yep.
On the other side, you have the patient that's very anxious, very overwhelmed by data, very, has other physicians they go and see, is getting conflicting priorities. And it's this very, like, they're calling you every day in the office twice a week. Like, not that you don't love them and want to spend time with them and make them feel seen and heard and cared for, but I recognize the opportunity for this tool to give that patient peace of mind that, hey, we're looking at the entire system here, right? And we understand what's signal versus what's noise. And now we have a prioritized game plan as to how we're going to first and foremost address health risk, right? Anything that's risky, of course, in the immediate term, but long term. Then we're going to focus on longevity and health span. And then we're going to focus on here and now optimization from there. Does that seem useful for certain patients in your practice?
Yeah, for sure. I mean, I'm in the habit, especially when I'm doing an annual physical or very much the first visit that I have with someone, I'm in the habit of sending them an email with a summary of everything that we talked about and mostly points about what they're supposed to do and what I'm supposed to do. And I'm using it for me too, because then I just copy and paste it into their chart so that I know what I put on them and what I put on me and make sure everything gets
Who's
done.
responsible? Yeah.
Yeah. So to have a broader reaching tool that would assimilate stuff not only from the day of the visit, but in the future and give a game plan, I think will be super helpful.
Yeah. When you first looked at QLP, because I first sent you the report, right? I gave you kind of a brief email explanation of like, here's what it's doing behind the scenes. What questions popped up? What were you unsure about?
The accuracy for sure. I mean, AI is definitely not there when it comes to making medical decisions.
Hence why we have amazing physicians like yourself involved.
Like,
Yep.
They need some oversight.
Yeah, absolutely.
So yeah, I have one patient in particular who literally will take all of his labs and reports and upload them into ChatGPT and has this running conversation with his ChatGPT about what it means, what it should do. And he'll call me and like read out what ChatGPT says.
What's the problem with that?
I mean,
I'm in agreement with you, by the way, but I want to hear you say it.
Well, so no, I mean, I think the problem is that it sounds so professional and it's taken as fact. Again, it's like this social media influencer who's, spouting off a bunch of things and you take it as fact. It sounds like it all makes sense, but I've definitely found blatant mistakes in, whatever it's spitting back as the diagnosis or the possibilities or the reasons for this lab being abnormal,
The big,
the
sorry.
accuracy is not there.
Yeah, and the big thing that I've found, and so that's kind of how QLP started for us, right? Is we had all this different diagnostic data, and we were just kind of asking it questions, right? I'm using it for all these other places, and our providers on site do as well. Like, hey, I wonder what this means, or like what's, how does this interact? Is there any interaction here? But we noticed that we could ask it the same question or a very similar question for the same situation and get a different output. And so it's kind of one of those situations, and this is super important for consumers to know, is that it's garbage in, garbage out. You have to be very specific in how you instruct AI to interpret the information that you're giving and what to do with it in order
Mm,
to get a consistent output on the back end. And so that is effectively how QLP was born, and that we now have a logic framework that in a Word document, for example, is about 40 pages long, instructing AI what to do with every component and every data point that it's taking in, how to interpret it, what the output has to look like, what information we're prioritizing, what we're kind of deferring for now. And even still with that, we have to have physician oversight, right? Like,
yeah.
so it's important for people that are using AI, because I'm guilty of it too. It's like, I'm not a physician. What does this mean? What is that? And if you're paying close enough attention, you will find inconsistencies and just blatant inaccuracies. And so again, having a great physician like yourself involved is really critical. And it can be, I guess it can be useful, right? Like AI can be helpful in
Oh
that
yeah.
sense of just helping patients understand stuff. But what do you think?
I mean, I would be lying if I said I didn't look stuff up all day. I
Yeah.
mean, back in the day before the internet existed, we all had a bunch of books in our
Mhm.
offices
Yeah.
and would go back to Netter's anatomy book and look and see
Mhm.
what things are called. Now we just do it on the internet. I think the problem is, like you said, what's accurate and what's not. What can you
Mhm.
believe and what you can't. So I have a very scrupulous eye when it comes to what it spits back at me.
Mhm.
I mean, I use open evidence more than anything else, just because that's combing through the medical literature and giving me a concise answer about certain things based upon what the literature shows.
Well, I think that's where AI is heading, right? And like, it's not, I can't imagine right now, maybe we're closer than we all think, of like an AI replacing you in your chair as physician, right? But it certainly makes you more efficient, right? Instead of having to go and thumb through the pages of the medical literature to find, this specific thing. And oh man, maybe it wasn't in that book, it's in this book. And now you're going to, just makes it more accessible and easy for you to take and synthesize all that information.
Hmm.
Would you agree with that?
Yeah, no, I mean, even yesterday, I was looking into what are the new treatments for prevention of Alzheimer's. So if you draw certain markers and see that they're elevated before symptoms even appear, what can we do now in the early stages to try and prevent progression or try and prevent it altogether? And like asking a question like that to AI is so helpful. I mean, it's very
Yeah.
concise. And then, I take it a step further, and that's, I guess, the difference between me and non-physicians. Like, you take it a step further and
Mhm.
say, like, okay, what are these two drugs? How do they actually work? What's the mechanism? What's the safety
Mhm.
profile? As opposed to a patient who comes in and says, like, hey, can I take,
AI told me
this?
this.
Yeah,
Oh,
AI told me to take this chemotherapy in
oh my
quercetin.
goodness.
Should I
Yeah.
do that?
Yeah.
And
Probably
I'm
not.
like, hold on, let me look that up first,
Yeah.
because, but in instances like that where I'm trying to find the newest mechanisms for disease or prevention, I think it's super helpful.
I have a question for you, because I've talked about this a few different times in different conversations, and I'm very curious as to the accuracy of the conclusion that I've come to. My dad's ortho spine surgeon, was, I think back when he was my age, right, around 40. So removed from med school, residency, fellowship, all that good stuff for about 10 years. Working crazy hours, 60, 80 hours a week, also in his office studying another 20 hours a week and reading literature and brushing up on procedures and yada, yada. Um, in building this, it became very apparent to me that physicians have to spend have to go so deep in their field to be experts, right? That it seems almost impossible that in a lifetime, right, that a individual physician could have the breadth of knowledge to understand how intervention in one health domain is going to affect all the other health domains and long term what the outcomes are going to be. Is that a fair statement?
Yes, for sure. I mean, it's like jack of all trades, master of
Yeah.
none. And I think even within subspecialties, you can do that. Not there's no one person who knows everything. And a lot of this is based on experience. And, when you're young and in medical school, you don't want to hear that because you think like, oh no, I can
I'm
just
going to learn it
study
all.
everything.
Yeah.
But
Not enough time in your
having,
lifetime.
yeah, I mean, having seen probably hundreds of thousands of patients by now, and I can definitely say that a lot of it is based on experience. But yeah, I mean, I don't even know that it's accurate to call anybody an expert in anything, especially
I
when
love
there's
that approach.
so many. There's the breadth of knowledge is just too wide.
So the question is then, right, if the analogy always uses that, look, as physicians, just having to be so deep, right? You have to be kind of 2 feet wide. There's just not the, again, human processing power and time in our lifetimes to go really beyond that. Do you think a system like QLP that has AI integration helps to broaden, maybe instead of 2 feet wide and 2 miles deep, help physicians to be broader, maybe 2 miles wide and 2 miles deep?
Yeah, I think so. I mean, I think it's more so taking what it gives you and then being able to apply that within your own constraints. I mean, this is why it's called the art of medicine, because everybody's painting is completely different. If you go
Mm.
to 3 different doctors and you ask them the same question, the same way AI will all give you different
Yeah.
answers. So I think anything that can be accurate, scientifically, medically accurate, and then be interpreted by a physician to help in the broad scope is a definite win.
So before you put your name behind something like this, right, agreed to be involved, what had to be true?
I think our relationship, like
Mm.
choosing to work on it together and having mutual respect for one another. Like I completely respect what you're doing with AI and trying to, at the end of the day, help me help patients better.
Mm.
And I know that you respect me, as a physician and knowledge wise to be able to contribute to it. So,
I was honestly really nervous to talk to you about it at first because I was worried, right? I could see how people would feel threatened by it and think that it may, again, replace doctors at some point, and that's certainly not the intention. Nor do I
Mhm.
think it has the capability to do what you guys do. So again, appreciate you being super open to it.
Yeah, no, I mean, I see it as a great tool that we all can learn from and hopefully adopt into practice in whatever form it is.
What would have made you say no if I had approached you this a different way
Um,
about QLP in particular? If there's something that it did, is there something that it could have done that would have made you say, no, I'm not getting involved with that?
no, I mean, I think as long as I can add in the medical knowledge, I'm comfortable with it.
Mhm.
Um, and you know, it, I do think it's a tool for physicians, not replacing us. And I'm realistic. I think a lot of medicine is going to be replaced by AI.
Yeah.
You know, probably
I think
within my lifetime.
a lot of everything is going to be replaced, right? And I think that that's a whole nother conversation, but it's funny to think about like what I think people that are used to coasting and maybe not really striving to be the best in their field and kind of always perform at a high level are going to be pretty easily replaced by AI,
Yeah.
which is a terrible and scary thing to think about. And there's all this talk of, universal income, and hopefully that's a real thing. Because otherwise I could see it being pretty detrimental.
Well, I mean, this is happening whether I want it or not, so
Yeah,
I might as well embrace it and be a part
absolutely.
of it and learn about it instead of fight it.
Yeah. What about QLP still needs to be proven to you?
I think I need more volume
Mhm.
to be able to see what the outputs are,
Sure.
in different scenarios. What is it going to say should be done? And then I need to, be able to know that that's what I agree with. So volume, I think.
What would you push back on, right? If you were looking at this, let's say you didn't know me, right? We didn't have the trust that we do between each other. What would you push back on, right? Of what you know of the system so far, where do you question it?
I question the accuracy of biological age
Okay.
already.
Yeah.
Yeah.
I know that about you.
Yeah. Not a huge proponent of that. I mean,
Yeah.
again, it's like one of those things that you get the result and what are you going to do with it?
Mhm.
It's either it's going to make you feel good if it's lower, if it's your age, you're still fine. I guess if it's older, then it could.
Can I reframe, I guess, maybe how we approach it at least, because we
Mhm.
utilize it. And again, it's kind of like, okay, here's how you're doing. But again, there are things you can do intervention wise to adjust not only biological age, but pace of aging. So as a more of a tracking metric, do you think it's useful? So like if we do biological age, right, today, and then do a bunch of intervention on the back end, whatever's appropriate for the patient, and then biological age and pace of aging have both come down a year later, is that useful?
Yeah. Yeah. I think anything that is a trend over time that will keep people engaged and motivated, whether it's biological age or A1C is helpful. I guess it doesn't matter as much what the number is, but more the trend of the number and how that affects how the patient feels.
Cool. For patients trying to be proactive, what do you think actually matters most?
Sleep, nutrition, and exercise.
I'm getting hammered with that today. It is
and glucose.
And glucose. No, it's great. It's a foundation, right? And it's so simple and easy. And it's kind of an unpopular answer because you can't really make money off of it.
Yeah.
Right?
Well, and I'd add to that knowing your genetic predisposition for, all kinds of disease, whether it's cancer or heart disease, knowing very clearly what role your genetics are going to play.
Is there a test you like particularly for identifying those?
It's me and the patient sitting down and saying, what are your parents like? What medications do they take? What about your grandparents? So yeah, no, it's really just family history.
Cool. If someone is trying to take their health seriously, what is one thing they should consider before taking any new approach?
I would say input and output. That's two answers,
Okay.
but it's kind of one.
Yeah, let's hear it.
Yeah.
Expand on
So
that.
input being, what are you eating? What are you receiving? And this is everything from your calories to your mental health. So what do you allow to be around you? That's toxins, that's toxic people, that's
Stress.
happy people,
Yeah.
that's stress, your job. What are you eating? What, pills are you taking? What are you injecting at this point?
What's the output?
And then what's the output? All those things that you're giving, exercise being a huge one. What is your outlook on life? How do you respond to all of those things that come at you? What's your stress level and how is that exuded?
So rapid fire questions.
Okay.
Couple words, couple sentences, keep it brief. And then we got 5 of those and then we'll be done.
Okay.
Sound okay? So rapid fire questions. What has to be true before you trust a new approach in medicine?
The medical literature.
Okay.
I will, with some caveats.
Okay.
Medical literature and my personal experience.
Great. Biggest misconception about being proactive?
That it will completely change your genetics and you'll never be sick because your dad had an MI at 50 years old, that you can completely overcome that. It's not possible.
Would you agree with the statement, and Dr. Skomer and I were talking about this too, it's all probabilities?
Yeah, I would say so.
So
I mean,
if
both
you
genetically and, epigenetics.
Yeah, environmental, yeah. What makes something feel credible versus just more hype?
Coming from a credible source.
There you go. Okay.
Yeah.
That's good. Where do patients rely too much on the system?
Social media.
Oh my goodness. Yeah. And it's funny, we even get it, we're doing things much differently, and not with the same depth that you're doing, but it's, we get patients all the time sending us stuff. And I'm just
The
like,
stupidest
is
stuff.
it's like, guys, calm down,
The stupidest
calm
stuff.
down.
Yeah.
What's one thing you're still figuring out in your own approach?
How to manage time.
Oh,
Yeah, I mean, there is not enough time in the day to work, be a mom, sleep, exercise, buy groceries.
yeah, you're a
you know.
beast. It's incredible.
Yeah, so time management, I think, is the
Do you
biggest
think
thing.
QLP will help you with that?
Do I?
Do you think QLP would help you with that?
Yeah, I mean, I think anything that can make my job more efficient when it
Mhm.
comes to documentation or, laying out long-term plans for people in a concise way. I mean, AI in general, hopefully, as it develops, will make me more efficient. Mostly when it comes to all of the things that I have to do in front of a screen, because that's kind of what I despise.
Really appreciate you being here.
Thank you.
Look forward to doing this again soon.
Me too.
Awesome.
Take care.